Good evening, everyone, and welcome to today's Back to School webcast, Coping with Psoriatic Disease, Helping Your Child Navigate School and Beyond. My name is Bev Bromfield, and I will be your moderator for tonight's presentation. Before we start, I would like to go over a few items so you know how to participate in today's event. We've taken a screenshot of the attendee interface. You should see something that looks like this on your own computer desktop in the upper right corner. You have joined the presentation listening using your computer's speaker system by default. This means if you can hear music through your computer, you should be able to hear the presentation. If you would prefer to join over the telephone, just select Use Telephone in the audio pane and the dial-in information will be displayed. You will have the opportunity to submit questions to today's presenter by typing into the questions pane of the control panel. You may send in your questions at any time during the presentation. We will collect these and address as many as possible at the end. Additionally, during the presentation, we will have questions for you to respond to through our audience polls, which will be featured on your screen. Before I introduce today's speaker, I would like to take a moment to tell those of you who may be new to the Foundation about who we are, our mission, and what we do. In 2014, the National Psoriasis Foundation developed a new strategic plan which drives everything we do as an organization. To achieve our mission, the following goals were identified: accelerate discovery to cure psoriatic disease, improve health outcomes, achieve goals to help reach our mission, whether it's being involved with an event or becoming a volunteer. By attending today's program, you have already taken a step towards expanding your knowledge about psoriasis and psoriatic arthritis to help manage your child's disease and to find others who understand what it means to live with psoriatic disease. You can help accelerate efforts towards a cure and greater understanding of psoriatic disease by participating in the NPF Corona National Psoriasis Patient Registry, which is the largest independent observational registry of psoriasis patients in the U.S. This registry represents a network of dermatology clinics that collect and study patient health information, allowing researchers to compare the safety and efficacy of psoriasis treatments, better understand conditions that are related to psoriasis, and explore the history of the disease. You can also share your experience with researchers about what it means to live with psoriasis and psoriatic arthritis by participating in Citizen Scientists. Answer questions and view your data along with over 4,000 participants. Data is used to help researchers gain a better understanding of the disease. To learn more and participate, visit the websites listed on the screen. We continue to help improve health outcomes through our Patient Navigation Center, the world's personalized support center for people impacted by psoriatic disease. The Foundation's Patient Navigation Center is available to help you find physicians, treatment information, navigating insurance issues, access support through our one-to-one program, and more. Contact us at 1-800-723-9166 or visit psoriasis.org/navigation center. To achieve the Foundation's goals, as mentioned, please support our mission through donations or by participating in local Team NPF events near you. You can learn more at psoriasis.org donate or teamnpf.org. On behalf of the National Psoriasis Foundation, thank you for attending today's webinar about factors that impact the physical and emotional well-being of a child living with psoriatic disease. Through this webinar, you'll learn about psychosocial issues and coping strategies to help your child or teen positively navigate issues presented at school or beyond. Now I'd like to take a moment to introduce you to our speaker, Dr. Rachel Pizor. Dr. Pizor is a pediatric clinical psychologist and an associate professor with the College of Health Sciences, Department of Behavioral Sciences at Midwestern University in Downers Grove, Illinois. Dr. Pizor's clinical and research training interests include behavioral sleep medicine, pediatric health psychology related to acute and chronic illness, and interdisciplinary education and training. Dr. Pizar is a member of the American Psychological Association and the Society of Pediatric Psychology. She has provided presentations in the past for the National Psoriasis Foundation for parents and youth living with psoriasis and/or psoriatic arthritis, offering strategies for coping emotionally with the disease. Please welcome Dr. Pizar.
Okay. Well, thank you so much, Bev, for that lovely welcome, and thank you to the National Psoriasis Foundation for inviting me to speak with all of you today. I really do kind of feel that it is my honor to be able to, connect with parents and with children who are living and coping with chronic illness conditions. So I'm very happy to be with all of you this evening. So to get started, one of the things that I would like to get a sense for from the audience members is the age of the children that you have that are living with psoriasis. So this leads us to kind of our first poll question of the presentation. And Bev, if you can put that question up. And this question is going to ask you about the age of your child. So how old is your child who you currently care for who is living with psoriatic illness? And your choices are, under the age of 1 up through age 5, 6 to 8, 8 to 12, or 13 to 18. And kind of by selecting one of these options, it'll help me to put some context around the rest of my talk to get a sense for the developmental age range of your child. So let's take a look at our results. So it seems like it's a pretty even split between younger children, school-age children, and teens. So the good news is that we're going to cover information related to both developmental ranges today in our talk. So thank you for sharing that information with us. Okay, let's see. So first I want to talk a little bit about what I hope is some good news. And this has to do with the impact of chronic illness. So a lot of times people equate a child being diagnosed with a chronic health condition to be a pathway to psychological issues. And the good news here is that what we know from the research and from clinical practice is that having a chronic health condition in childhood, such as psoriasis, does not mean that serious psychological problems are inevitable. And I think that that's a really important kind of take home from this talk, is that we do know that many children and many families living with chronic illness show great resilience in the face of chronic illness. And whether it is consistent resilience or whether you have a child who struggles at times but is able to cope and to work through it, they're able to live healthy and well-adjusted lives in the face of their chronic illness. So that's an important takeaway. We do know that there are kind of what we would consider chronic illness or chronic health conditions to be a risk factor for the development of psychosocial difficulties. What that means is that just like many different things in life that make us more vulnerable to having some type of psychological or psychosocial difficulty, a chronic health condition is one of those things. So we see that there are typically kind of 3 categories of youngsters when it comes to coping with chronic illness conditions. We see that some children are going to cope quite well. They're going to actually have very limited impact on their psychosocial functioning, and you're not going to see a great impact on their daily living their daily functioning in school, at home, with peers. The next group that we see, and again, often we see that this is the larger of the 3 groups, is that some children will show some difficulties, some ups and downs, similar to what you see with other areas of difficulties with kids, periods of strength and periods where things are a little bit more difficult, but they generally function okay. And then in our last category, we have a group of children, a group of teens who show more difficulty. They have more difficulty coping and adjusting to their chronic illness condition, and these difficulties then may lead to more serious psychological conditions such as depression and anxiety. And what we know is that children with psoriasis have been found to be at higher risk for those two conditions in particular, so depression and anxiety, when we compare them to kids without a chronic illness, and in some studies to other children with different types of chronic illness. So we want to try the best that we can to understand what kind of mediates this relationship. So what makes a child more vulnerable to psychosocial difficulties in the face of psoriasis? This is always kind of a hard thing to answer, because unfortunately, although we might like to have a clear answer on this so that we could tell parents, this is the thing that you should look for, this is what you should be watchful for. Unfortunately, we know there's not one specific thing that signifies a greater risk for your child or for your teen. We do know there are a couple of things to watch for, and then some additional considerations that we'll talk about on the next slide. But one of the things that I'm sure as parents you're very aware of is that children versus adults with psoriasis are more likely to have visible psoriasis, plaques or lesions on their face, or areas that are more visible to others. This visibility of the illness can often be a challenge for kids, and this can lead to more episodes of bullying and teasing, and can start to impact things like self-esteem and self-confidence. The other thing that we know is that children with psoriasis and psoriatic arthritis are also at a bit of a higher risk secondary to pain and some of those additional illness management concerns. So when you have a more complex treatment regimen, that can lead to treatment fatigue and can also impact the quality of life that children living with psoriatic illness can face. And then also, this one is of particular interest to me as I do a lot of work with kids around sleep. Children with sleep difficulties and psoriasis also appear to be at a greater risk for quality of life issues. And this is significant because when you are living with psoriasis, the discomfort of the illness can lead to some impairments in your sleep. And we find this both in kind of the pediatric population and the adult population. And then getting, less restorative sleep can also impact our daily functioning, our health, our wellness. So it's a bit of a cycle. So attending and kind of assessing for your child, how are they sleeping, and whether that's something that you can connect with your pediatrician around will be important. A few other important things to consider, and we're going to go over these individually as we go through this slide. Some things to think about is how old was your child, we're going to start with how was your child functioning before they were diagnosed with psoriasis. The next consideration is at what age was your child diagnosed with psoriasis? How publicly visible is your child's psoriasis? And how do they approach coping with their illness? So we're going to break these down a little bit. Prior functioning. So one of the things that we know fairly clearly across different chronic illness conditions in childhood is that children who struggle with emotional and or behavioral concerns prior to the diagnosis of a chronic health condition are at a higher risk for struggling more to cope after they've been diagnosed. So one of the things to think about is, before your child was diagnosed, were they struggling with an emotional concern like anxiety or depression? Were they struggling with a behavioral concern like ADHD or some of the other behavioral disorders? Or perhaps a developmental delay or developmental concern? These are children who typically are at a higher risk for adjustment problems or being able to cope with this additional stressor. So one of the things to think about is if you think that your child fits this description, it might be a prudent thing to talk to your physician about a referral to a pediatric health psychologist in your area, particularly if you're seeing these issues that your child may have been dealing with prior to their psoriasis or psoriatic arthritis diagnosis as currently impacting their coping. Now, pediatric health psychologists, which is my background, are specialty trained to work with children who have chronic and acute health conditions. So what's nice about that is if your physician is able to point you in the right direction, or you're able to call a local children's hospital and get a referral for someone who specializes in this area, is that they will have some background and some training on how to help your child specifically cope with the issues they had prior to the diagnosis, and kind of accounting for those in light of their chronic health condition. The other important takeaway from this that I think is really key in terms of, kind of calming fears that typically parents have when they hear this, is that the bright side of this is that children and families who have a history of struggles prior to a medical diagnosis, also, it's important to understand that these previous experiences of working through challenging circumstances, both as a family and as an individual child, are going to often serve you well as you approach this new challenge. So it's one of the things that as a parent you can do, is to provide some hope and some reassurance to your child that this is something they can actually pull from to show they can be resilient. And that you as a family can come together and work really through any challenge. So that assurance and that support is important. So the next polling question that I want to get to as we talk about age of diagnosis relates to how long the child or the children, I guess this might be tough if you have more than one child who's living with psoriatic illness, but how long has your child been living with psoriatic disease? The answers are 1 year, 2 to 3 years, 3 to 5 years, and more than 5 years. And I think what's important for me is I'm kind of getting the information about how long your child has been living with psoriatic disease. It helps to provide some context for some of the conversation that we'll have about adjustment to illness in context of age of diagnosis. Okay, so how long has your children been living with psoriatic disease? The results are, it seems like most have been living with psoriatic illness for 5 or more years, with fewer newer diagnosed, but we're actually again going to cover both, but it's helpful for me to have that context. Okay. Oop, let's go back one here, sorry about that. So age of diagnosis, kind of what do we know about this? Again, there is no one age that is more emotionally protective to being diagnosed with psoriasis than another age group. But the considerations related to age of diagnosis might look pretty different depending on when your child was diagnosed. So when children are diagnosed at a younger age, some of the things to consider is that living with it for a longer time allows them this time to kind of come to accept their condition as they grow up with it, and they kind of learn tools along the way from their parents, from their peers, from their physicians, and kind of their own internal strengths. So it allows for more time for that. They also often grow up with a better understanding of what psoriasis is. So if you were diagnosed as a young child, you grew up learning about psoriasis, again, from your parents, from your providers, and you have a higher level of understanding and knowledge about it, which can be helpful. But we also see the other side of this, which is as you live with any type of chronic illness condition, and your part of that is engaging in these illness management behaviors and the stuff it takes to treat and care for your illness, you often can develop this feeling of being tired with your treatment, or what I coin kind of this treatment burnout. You just feel like done and over it. A lot of the teens that I talk to often present with this. You know, they feel like they're just sick of doing it, in particular in light of when treatment doesn't seem like it's working. That treatment burnout, that treatment fatigue can be more significant. So when you live with something for a longer period of time, there's kind of more time for that to build up. I think that, and it sounds like there's a number of those of you in the audience who have children who have been living with psoriasis for 5 or more years. Some of you are parenting teens with psoriasis, and there really are, I think, some special considerations. So whether you have a younger school-age child who is going to become a teen, probably fairly soon, or if you're parenting a teen currently, it's important to talk about some of these. So teens, whether they are newly diagnosed with psoriatic illness or they're just learning to adjust to it in this new developmental range, have somewhat of a complicated developmental task. So all teens, whether you have chronic illness or not, go through a period during adolescence that includes a focus on trying to fit in with their peers, really finding their identity and figuring out who they are as an individual outside of the context of their family, which is how we view ourselves as when we're children, and then coming to build more adult-like relationships. And teens who have a visible difference, often for those who live with psoriatic illness, may feel particularly challenged during this time. Especially when it's a newer diagnosis during their teen years, this can prevent them that kind of time before the teen years to learn to accept this as a part of their life, not who they are, but a part of it. And then learning to cope before the teen years. When you're a teen and you're newly diagnosed, it can be tough because you're trying to figure out how to deal with psoriasis. At the same time, you're trying to fit in with peers, often kind of trying to be the same as others, and trying to find your identity. So it can be more challenging. We're going to talk about some of the things that we can do to mitigate those circumstances. So how do we promote and help to promote resilience, especially during the teen years? One of the consistent findings across chronic illness conditions is that social support is incredibly important to adjustment during adolescence. So there's some good news here, because what we do know is that it doesn't mean that all of the peers that are around your child, so if they're in a classroom, it doesn't mean that all of their classmates have to be warm, supporting, and accepting of them. But it is important that they have access to some trusted friends. So teens really rely on having a core group of friends, and some studies show us even just one close friend is enough. So they don't need a large peer group. It's okay if they have it, but if they have a couple of people or even just one who they can really connect with and they can receive support from, this social support we know serves as a protective factor. So what does that mean in terms of how you as parents can help? One of the most important things is to allow and to promote access to their peers. So encouraging peer connection, and this is a tough one, and we'll come back to this, is avoiding using you can't talk with or go out with your friends as a consequence or punishment when possible, because we know how critically important social support is in the teen years. Being a pediatric psychologist, I will say that this is a tough piece, especially when you're talking about teens who may be pushing back on their treatment regimen, who may be not wanting to engage in the things we know are going to keep them healthy. And so this can become challenging, because when kids are mostly motivated by social interactions, and they're not taking care of their health in a way that is important, safe, and protective, often the first go-to is limiting some of that social connection, because we know it can work, right? It's what motivates kids. The biggest piece of advice that I can give to parents around this is, if it feels like it's the thing that you need to use to really promote motivation, whether it's with school, whether it's with illness management behaviors, making sure that you're using it in a way that helps to actually promote motivation. So the example I like to give is, instead of thinking about grounding a teen for a month with no contact with friends, that example doesn't promote their desire, excuse me, to do better, to get access to their friends, because they're just kind of waiting around for a month until they get that access back. If, however, you were able to take a situation like they weren't engaging in their treatment, you would be able to say to your teen or to your child, you're not doing the things that are important to keep you healthy. Because you're not doing that, you're not going to be able to go out with your friends on Friday night. But if you can pull it together and start taking care of your health and do the things we know are important for you and your chronic illness, then we can reassess on Saturday whether or not you can go see them. So there's a kind of a middle ground there, and that actually, again, promotes their desire to engage back in their treatment. So that's one way that you could think about it. The other thing to think about, again, as we've started alluding to, is, and again, I'm sure you're all very aware of this, as you live with your child and help them to cope with psoriatic illness, is that the visibility often invites unwanted questions, stares, and teasing. So one of the other important parts of this is that visibility, when you have a chronic illness that's more visible to the public, it takes away the individual's autonomy of choice to share what they want with others. So if you have a different chronic illness, you can choose what you want to share. When you have a chronic condition where others can see it, it takes that away. And that means the child or the teen can feel like they lose some control over their own bodies and over their own kind of choice to share. So we're going to talk about how we can mitigate that a little bit. So moving forward. Oh, I think we have another poll question coming up here. Let's see. I think we've got one coming. This is going to be a question that's going to ask you to think about whether or not your child has ever shared with you that he or she has been bullied because of their psoriasis. And obviously there's yes, no, and also I'm unsure, because sometimes that is indeed the situation that parents face. They're just not quite sure if their child is being bullied. Okay, so this is not surprising to me. So 100% of you do know that your child has been bullied because of their psoriasis. And this is a fairly common finding in what we see in the studies of children who are living with psoriatic illness. Okay, so let's talk a little bit about what we can do with that. Okay. Go past this. Okay. So how do we work with our kids when others are being rude to them, bullying them, or teasing them? The first thing is to think about some of the developmental factors that are at play here, and then we're going to get into some specific strategies. So with younger kids, they really may be less aware of the perception of others, and parents often have to be the ones who kind of respond in the moment to those who are being unkind. For older children, that's when they're going to really start to notice the differences between them and their peers and feel more uncomfortable and unsure of how to respond. And then we can implement some of these strategies. And with preteens and teens, again, this group is much more highly aware of appearance, and they're focused on their differences. And what we often see with teens is this vacillation. Again, they're kind of trying to figure it out for themselves. So they may vacillate between really feeling like they want to be their own self-advocate, kind of stand up to those bullies, and at other times just saying, you know what, I just want to fit in. And they don't want to be their own self-advocate. They just want it to be different. So if you see that in your teen, know that that is a fairly normal reaction. It's kind of a part of that developmental process for them, trying to figure everything out. Okay, so what can we do? The first thing is, as a parent, it's important. It's sometimes something that we don't really think about, but serving as a good model for healthy body image. So celebrating your own body flaws and being cautious of how we speak negatively about them. So because we know that psoriatic illness can be genetic, some of you in the audience may also be living with psoriasis, but even if you are not, we all have things that we don't love about our bodies. And we want to just be careful of how we talk about it within our family. So the example I have here is thinking, I hate my arm fat, so I never wear tank tops. This is something I think that's pretty common sometimes. And it's also pretty common to talk about it, right? We don't think about it as necessarily being a bad thing. And in isolation, it's not. But sometimes we're communicating these very subtle messages that our kids pick up on, and it just communicates, you know, appearance is something that's important and others judge us for it. So celebrating our own kind of body quirks can be important. Also being a good model for how to speak to others about psoriasis or psoriatic illness. So one thing it's helpful to kind of talk with our kids about is Unfortunately, we cannot control the comments and the looks from others, but we can control how we perceive these and how we respond. So we're going to go over that. But yourself, by modeling or showing your child how to respond assertively versus not responding aggressively, will help your children to grow into their own kind of confident style of responding to those who would be unkind. And allowing your child to grow into comfort with the visibility of their psoriasis. So as parents, we want our kids to feel comfortable. We want them to feel confident. We want them to be able to live their life in whatever way they need with their psoriasis and not feel like others are judging. That's a parent's job. We want that so badly for them. But what is kind of one of the approaches that can be helpful is like finding this balance. We do not want them to avoid because then they don't get the exposure to learning that they can cope. But at the same time, we also don't want to push them too quickly or without support, because then they feel really unanchored and they feel like, I don't know how to respond in these moments. So an example here might be, if the child is really concerned about going to the beach, but it's safe for them to do so, with their condition, they're at a good place in their treatment and it's something as a family like you guys would normally celebrate doing. Don't avoid it because of the concerns perhaps, but think about how you can help them to be more comfortable. Is there a cool rash guard that wouldn't irritate their skin that they could wear, that they could pick out that might be kind of cool, or a lightweight shirt to help them to feel more comfortable? But there's a balance here, and there's no right or wrong answer. It's just kind of, you guys know your children the best and trying to kind of estimate what that balance is. So here's a discussion example for us to kind of unpack. So in this situation, someone stares openly at your or your child's psoriasis plaques or lesions, and you'll see it's not just situation and reaction. We have this middle column here that talks about that concept of perception that I just brought up. So a helpful perception, which again is kind of like how we think about things. Like the way I talk to kids that I work with and teens is perception is all about like kind of the glasses that we wear. We walk around with these lenses on, and the lenses filter all of this information from our environment. So sometimes our lenses are rosy and bright, and they filter information from the environment in a way that's really helpful to us. It has a bit more of like a positive or even a neutral spin. But at other times, especially when we're feeling depressed and down, we can wear these glasses that are much more dark, right? And they filter everything in a way that is hurtful and that's very negativistic. So when we see this occurring, whether it's at school or in the community, we think, and the helpful side, I think they're probably wondering about my skin. Maybe they're worried about it being contagious. In this example, we're kind of taking it outside of ourselves, and we're thinking it's about them. They're wondering about it. And in this way, the response might be vocalizing this. Like, I notice you're looking at or if you're a parent, my daughter's skin condition. She has psoriasis, and while it can be painful, you can't catch it. It's really nothing to be worried about. A hurtful perception with those darker kind of negativistic lenses might be, they think I am gross and they're going to catch something from me. In this situation, you see the situation is the same. It's someone staring openly at them, but it's how we think about it that may mediate how we react. So if we think kind of in this hurtful way, we may react by saying, what are you looking at? Staring is very rude. And while that is accurate, staring is rude. And while it may be exactly what we want to ask, often that type of reaction leaves us feeling kind of uncertain, unsure, and regretful. So why is how we perceive others' intentions so important? Perception is a key component to how we think, and our ways of thinking about things, including how we think about our illness, shapes how we feel inside and ultimately how we behave. So in the example that I gave, if we perceive or think that others are judging us as gross, we are more likely to feel sad, angry, and anxious. However, if we perceive or think that the stare comes from a place where the stranger doesn't understand, it's not about us, it's about them and their lack of understanding, we're able to distance the incident from ourselves a bit more, and our feelings and behaviors are in turn less impacted. And again, and that was kind of a slide about the perception, but also about the responses. So how we act in response to this type of rudeness can also shape how we feel, both in the moment and later on. So in the previous example that we saw, when we are able to remain a bit more calm and to educate others, we have actually been able to take some control of the situation. And what we do know is that control in the face of stress is generally a good thing. Control helps us to feel more confident and more secure. In the example, when we respond in an angry fashion, we lose some of that control. While in the moment, we may feel a sense of relief for kind of having stood up to that person, whether it's a peer, a classmate, or a stranger. But ultimately, this type of response often leaves us feeling more regretful and uncertain in the long term. And again, it's because that feeling, that sense of being momentarily out of control. So how do we help to shape our children's perception of others? One of the things that you can do, and this is not an easy answer, and if you feel like your child is really walking around with those negativistic kind of glasses or lenses on, this again may be something to think about, whether or not you can connect with professionals who can help them to kind of switch or help them to develop more productive ways of thinking. But this is a good practice to kind of help to see if this makes a difference. And that's really to talk openly with your child or your teen about what others see when they see psoriasis. So often we feel like we know this is a sore spot for our kiddos. You know, they don't like that others can see it. They don't like talking about it. But helping them to see that it is often not what they think it is can be helpful. So just some verbiage here. You know, when others see your psoriasis, most often they're likely wondering what it is, and they are curious. They may also be worried both about you, is he okay, or maybe worried that your condition is contagious. And this is important. You know, the reality is psoriasis is not contagious, so yours is not, but most people don't necessarily know that. It's a lack of understanding. It's an ignorance to what psoriasis is. So when people stare, it absolutely does not feel good. But when we think about it, we can have a better understanding that it's really not about us, but about the fact they don't understand. And now, you know, let's talk as a family about how we respond when that happens at school or in public. So many adults, as you know, have a difficult time learning how to respond to bullies. It still happens in adulthood, and it certainly does not come easy to children or teens. So talking with your child ahead of time to prepare for how to handle these instances in school and the public can really be vital. And it's important to assume that to not assume that no news is good news. But it sounds like your kids from the polling question we did are being open with you, and that's a great thing. So when you know it's happening, you can help them to kind of come up with strategies to combat that. Also helping to promote the understanding that there is no one way that's the right way to respond. Sometimes ignoring the bully may be the best. But for some kids, that's not safe to do, or for some kids, they don't respond to ignoring. So other times it may be best to find an adult, someone safe that they can go to. And other times it may be that speaking up and kind of assertively responding to the bully may be best. But helping your child to understand there isn't one right way, and talking to them about what way feels comfortable to them is important. This also alleviates pressure that they are either right or wrong with how they respond, and helps them to find a more natural rhythm. In addition, excuse me, if you do worry that your child is really being significantly impacted by teasing or bullying, it's important to go to your school, have those open conversations with the school, and hopefully maybe help to garner some support from a school social worker, or see if school counseling is available to you and your child. Some school-specific strategies. Does your child have a good friend in their class? Again, we know it really only takes one. It's great if they have more friends that are close and trusted, but if there's one, you may consider speaking with a friend's parent with your child's permission, or prompting your child to speak with a friend themselves to promote a higher level of understanding from that peer about psoriatic illness and encouragement of an ally within the classroom setting. Also, how does your child feel about sharing information about their psoriatic illness with their teacher? If they're comfortable with it, you may consider having your child involved in the discussion with the teacher. That way they're getting that in the moment self-advocacy of sharing what they're living with, and also allows for creation of a safe space to go while they are in school. I think this is also something that's very important for us to discuss, which is allowance for negative emotions. You know, I work with a lot of parents who have children who have a lot of different chronic illness conditions, and we so desperately want for them to not feel pain. And inadvertently, we can communicate this sense of urgency to prevent feeling sad, worried, or angry, especially in the context of an illness. So it's almost like one of the absolute seminal parts of being a parent is to protect your children from this and to want to make it okay, to make it better for your child. But at the same time, it's important for us to communicate to our kids that chronic illness does make us feel sad. It makes us feel worried and angry, and all of this is okay. We're going to talk about the signs to look for that show it might be getting to that level where there needs to be intervention, but it's normal. It's normal for them to have these reactions. So normalizing that really helps them to understand they're not wrong. And also helps them to sometimes become more open to coming to you and expressing these emotions. So one example is after a long struggle with finding the right treatment plan, yet another attempt at finding the right fit has failed, so the treatment is not working. It's normal for your child to feel sad, upset, frustrated, and disappointed, and it's also natural for a parent's instinct to want to prevent these feelings. So what do we do? First is kind of try to avoid telling a child how to feel in an effort to stop their emotional distress. It's really normal, right? A thing that might just pop out of our mouths might be, I know it's hard, but you can't let it get you down, right? You're saying that because you don't want it to get them down. It seems very natural, but it can also communicate to the child, like they might perceive it as, you know what, my mom, my dad, they just don't get it. Because in reality, I do feel down. I feel frustrated and disappointed. Let them know, here's what you can do. Let them know that you do understand it's hard. I know it's hard. You might even say, I'm frustrated too. I feel you on that. When treatment doesn't work after trying for so long, it can feel really upsetting and disappointing. Just kind of validating these feelings, reflecting these feelings can help your child to feel heard and understood. And then importantly, providing reassurance and support, right? I want you to know that I'm proud of you for continuing to face the struggles here. It's not easy, and you have been very strong. And when you don't feel strong and you feel sad, frustrated, and upset, come to me and I will be strong with you. And you can't promise, right, that you're going to find a treatment that absolutely works for your child, but you can promise your child that as a family, you're going to work together with your doctors to keep trying to figure it out. And that's really the best you can do in that situation, right? You want to support them, validate them, and help to focus them on keep moving forward. So some tips to promoting more healthy coping. You know, think about not just coping in terms of what makes a child feel better in the face of psoriatic illness, but you guys all know your children the best, more than anybody else. So what typically makes your child feel better when they're sad or distressed? Help them to kind of engage in those activities when they are feeling distressed about their psoriasis. And if you're unsure of what helps, engage your child in problem solving about how to best cope. So with a younger child, you might say, you know, let's try to figure out what might help you to feel better right now. Would you like to cuddle on the couch and read with me, or would you like to get the crayons and markers out and draw? So especially for children who have trouble thinking about choices or thinking about things, kind of giving them some options and saying, let's try it out. You know, they might still say, I don't know. And you say, well, let's try it. Let's see if doing this helps to make you feel better. You kind of do your own little investigation. So we've talked about how some of the signs and the difficulties with coping are normal, and it is. But then we also, again, if we go back to the beginning of the talk, have a category of kiddos who are going to fall into a category where these normal kind of adjustment difficulties to the illness are going to become bigger. and be a sign that more assistance is needed. So things like sudden changes in mood that last for longer than a few days. So if we see a change in mood that's fairly significant, that's lasting a week, more than a week, right, we may want to consider getting some additional help. A change in your child's desire to do things that they usually find fun. Are they pulling away from activities that really used to kind of fuel them? Your child pulling away from friends. So again, remembering that social support is really important to adjustment. Are they actually avoiding peers and not wanting to engage anymore? A change in your child's grades or notes home from the teacher more frequently. Seeing that your child is more angry or irritable most of the time. One of the things that's important to note about depression is that depression in children and teens often looks somewhat different from depression in adults. When we think about someone who's living with depression as an adult, we think about that lethargic, kind of very sad, down in the dumps presentation. With kids, especially with younger kids, we tend to see more irritability, more anger. So take note of that. Also, is your child having consistent difficulties falling asleep or staying asleep? Once this reaches a certain level, then you not only have, the frustration with not falling asleep, but getting less sleep is going to actually go back and impact their chronic health condition. And then for the last point, which is incredibly important, if your child is talking about feeling hopeless or is having thoughts of wanting to hurt themselves, then this is a sign, that's why it's asterisked, that you really do need to seek more immediate help. We want to make sure that kids who are expressing those feelings and those thoughts get an assessment. And again, it's not to say, that it's, many kids will think these thoughts, but we don't want to kind of put them to the side and say, well, this happens, all kids have these thoughts. We really want to make sure that we are getting it looked at by a professional. Okay. So the last section I want to kind of talk about before we open it up to question and answer is the special topic of illness management, which really has to do with all of the different activities that one has to complete to care for their chronic condition. So we don't have a lot from the research that we know about illness management in children with psoriasis, but from the adult literature, we know one of the things that often contributes to difficulties here is the time that it takes to manage their illness. This leads to more frustration with their illness and then in turn impacts their ability to stay motivated and consistent. Other factors that we find to be associated are things like the feel of topical treatment, so that kind of greasy feel or, staining of the clothes or just not liking the sensation of it. Also the smell of the topical treatments. So thinking again about our teens who just want to fit in and not appear different, this can be particularly difficult for them. The complexity of the regimen. So the more complex a regimen can become, the more kind of some of that treatment burnout we see. And the less motivated kids can feel to engage in the treatment. And then I think often, most important for many is the perception that it doesn't work. So if we think about it, an example I usually like to give when I'm talking about illness management, is when I get headaches, I know that every time I'm going to take Advil. Why? I know because it works. If a physician prescribed me something else that I don't perceive as being helpful, I'm probably much less likely to do it, right? So, the journey for the treatment of psoriatic illness can be filled with ups and downs and frustrations. And when it feels like it's not working, and again, there is no exact cure here, so these feelings can be prevalent, it can be tough. So how do we navigate this? One of the things is, again, that normalization. It's not an excuse, but normalizing that problems with adherence to illness management are a struggle, and they're not alone. We know that upwards of 50% of children with chronic illness conditions struggle with illness management, struggle with adherence. So what do we know helps to mediate some of the success of adherence to regimen? It often changes over the developmental spectrum. So with younger kids, some of it is, again, much more dependent on some of those behavioral management strategies that parents engage in. So one of the best strategies that I often promote for parents to use is that when-then type of command. So engaging in those fun activities, those things that they love to do, has to be contingent dependent on engaging in the behaviors that are critical to their health. So once they engage in their treatment, they're able to access those things that they prefer. For older children and teens, it really becomes more of a shared responsibility of the regimen across parent and child. So engaging your teen in helping to make treatment decisions and finding control. So here are some tips. So providing options for control as much as possible for your kids. Children as young as 6 or 7 can begin to participate in their own illness management, and you can help to promote their integration into treatment decisions with their physicians. So talking through questions, and I either have them on the slides or I have them in the handouts that you can see that are associated with the webinar. There are some additional tips for how to manage this. And allowing choice when possible for interventions both at home and at school. Another part of this is predictable schedule. So kind of knowing when to expect aspects of their treatment we know can be very important. And when possible, scheduling appointments so that they do not conflict with your child's leisure or fun activities. Unfortunately, this isn't always possible, so when you can, you do it. And again, it might be something to collaborate, especially with your teen on. Here are all the things you want to do. Here are the appointments we need to schedule in. Let's talk about how we're going to make this work. And when it's not possible to avoid conflicts with preferred activities, one thing is to not make this then become a power struggle. So don't get angry when the complaints start to come in, right? They're not going to like it when they have to skip something fun because of their chronic illness. And that's normal. We would expect that, right? So we don't want to get angry. We want to show some understanding and empathy, yet remain focused on what we need to do. And also remain focused on allowing them some control. So while this is not what you want to be doing, and I understand that, going to this light therapy appointment is helping you to gain some control over your psoriatic illness. And then problem solve concerns with your treatment provider. So help your child to prepare for their physician visits by asking them some of the following questions. And you might think about whether or not you have them write the answers to these questions down, or you write them down and then you prompt your child to engage with their physician around it. What is the hardest part of your regimen? Can you describe what makes it the most difficult part? Is there a part that is less difficult than the others? And the answers to these questions can be vital to your physician in terms of thinking about, are there changes they can make to help to mitigate some of those concerns? And again, really prompting your child and teen to share these thoughts with their physician can be important. It helps to kind of help them to develop that self-advocacy. Okay, so I think we're maybe at the point where it's question and answer. I only know that because it feels like I'm not able to move our slides together. So, and I think it'll be great because it would be nice to be able to answer maybe some of the questions. Oh, thank you. Thank you, Bev. Last slide. And I think the point I want to end on, we've already talked about that kids with psoriatic illness are at a higher risk for depression and anxiety, so seek supports when you need from professionals. But this is important for me to share with you guys, and I'm sure it's not information, again, that you don't clearly know, and that's that parents of children who have a chronic illness are in need of support as well. So don't forget to care for yourself, and to know that caregiving in the face of childhood illness can be challenging, it can be rewarding, and it can have all of the feelings in between. And it is so important that you prioritize yourself as a parent so that you kind of strengthen your own internal abilities to cope. It makes you an even stronger parent. So don't neglect yourself. It's a message that I think is always really important for parents to hear. Even if you already know it, just keep reminding yourself of it. Okay, so now I do believe we are at the question and answer section. And so I'm curious, I know there were a couple of questions that came in prior to the presentation. And I'm just wondering, Bev, if there's any others that might have come in the interim. But one of the questions, I'll go ahead and start with a question that came in that's asks, how can you help a freshman in high school to become more confident and less self-conscious about the appearance of their skin? This is a great question, and I think it's one that it doesn't have a very easy answer. I think some of the things that we've already talked about with regard to helping kids to find their comfort zone with self-advocacy can be an important tool here, because as your teen learns to kind of advocate for themselves in a way that feels comfortable, it's helping them to learn how to cope with the illness. And that can help to mitigate some of those concerns that teens naturally have about their appearance. The other thing, again, comes from that social support. So being around other people who accept you, who support you, who are kind and don't make everything about your illness, allows for kind of a natural increase in one's self-confidence, because they're able to navigate these peer relationships relatively successfully, or at least as successfully as other teens are able to kind of navigate things. And the other is for you as parents to really promote and help them to focus on the things that make them special and the things that make them shine. Because I think that especially for teens, their identity can be so filled up by their chronic illness. It's like if you had them fill in like a pie chart of what they often focus on when it comes to themselves. A big piece of that pie may be filled up with their psoriatic illness, because it consumes a lot of their attention, because they're so worried about how they may be different or perceived differently by peers that it builds up a lot of their mental energy. And they forget to kind of focus on the things that make them special, that they're really successful at, that kind of feed their strength from inside. And so really helping, to focus on those things. It's not even something where as a parent you have to say, don't focus on your psoriasis, focus on how well you do in school. It's through your kind of day-to-day interactions with your child on championing the things that they do well. That can be incredibly important and fulfilling for their self-esteem, their confidence. And then finally, having them press themselves. Again, it's that balance between comfort and challenge. But when they are able to see that they can successfully navigate challenges, when people are staring, when people have rude things to say, that they're able to take control of some of that situation. So again, not responding aggressively in a way that can leave them feeling a little bit out of control or uncertain, but controlling it and saying, you know what, this isn't about me. This is about their lack of understanding, their ignorance to my condition. So that kind of self-advocacy in the moment can make them feel more confident. And the tough part about that as a parent is just trying to find that balance between pushing them, but not pushing them past the point where, they feel overwhelmed. And my final piece to this question is just to think about, if you do feel or you sense that your teen is really struggling, like none of these things are working, they really seem like they can't find a way to view themselves in a positive light, that they're walking around with those shaded dark lenses and everything they filter is negative about self, about others. That again may be a sign that your child might be struggling with depressed mood or depression. And that's when folks like me, psychologists or pediatric health psychologists can come in and help them to kind of shape, again, that perception. I think that can be quite helpful. And then the final question that I think I have here is a question that says, stress seems to activate a serious breakout and can be embarrassing for our teen. Is there a way for them to address this with their doctor? And I would say absolutely. I think I love, the idea here within the question that the teen is speaking directly to their physician. So that's incredibly helpful for their own ability to kind of advocate within that patient caregiver relationship. And then the second thing is that what I would see in this question is that it's the stress, right? It's the stress that probably needs intervention. It may be, again, and 100% correct, we know that stress activates and can lead to flares in psoriatic illness. So there's lots of strategies that kids can use or teens can use to manage stress, but if it's to the point where it's really impacting the illness, right? It is setting off flares, it is impacting their functioning, it is impacting their treatment, then this is a situation where I would probably recommend thinking about, is your teen open to counseling? Are they open to a professional whose job it is to help them to learn strategies? Having said that, one tool I would like to give you guys to think about as something easy and accessible for teens, a lot of teens that I work with use an app, so for the cell phones that a lot of teens have, not all, but a lot do, called Calm. And you can access the website at calm.com. So I use this a lot with teenagers that I work with, and it has a number of different relaxation activities. It helps kids to learn how to do deep breathing, some kind of mindful meditation. It pairs some beautiful imagery with these activities. So some teens, not all, that I work with have found this to be a very helpful tool for them. And so it's something to explore. You may want to look at it first. It's free. There are things that you do need to buy, so you might just want to have a conversation with your teen about that if you do recommend using it, but it can be a helpful self-management tool. So as far as I can see, it doesn't look like any additional questions have come in. But I would like to thank, again, the National Psoriasis Foundation and for all of you for joining us this evening and for sharing the way that you did through the poll questions that you've answered. So thank you very much.
Thank you, Dr. Pizor, for a wonderful presentation with a lot of really great tips for our parents that are attending tonight. Just a reminder, the handouts are loaded within, you should be able to see those available. We will also place this webcast on our website here shortly, along with the handouts for you to access later. I'd like to take a minute to let you know that we do have some additional support. If you would like to chat with another parent, please consider reaching out to our one-to-one program for help. With the trained volunteers provide information about the disease and resources, keeping in mind that they do not provide medical advice. Request a one-to-one program volunteer, visit psoriasis.org/one-to-one or call 1-800-723-9166. Speak with a patient navigator who can connect you with the one-to-one program. If you have any other questions, please contact our Patient Navigation Center by phone, email, live chat, or Skype. Once you leave today's webinar, you will receive a survey on the presentation, and we would appreciate it if you could complete that and provide your feedback. For resources specific to youth and you as a parent, please visit our spot at psoriasis.org/our-spot. Resources include age-appropriate information up to age 18, personal stories, and after tonight, as I mentioned, a link to the webcast that you just heard, and also last week's webcast about education law and how it affects your child. Finally, I'd just like to mention you can access our complete webcast archive by visiting psoriasis.org/webcast. Thank you to everyone for joining us tonight, and have a lovely evening.